Hello, I'm Dr. Naeem, and welcome to my channel, MedWise by Dr. Naeem. Today, I am taking on eczema in children. I'll cover its types, the anatomy and physiology of skin, causes, signs and symptoms, diagnosis, treatments, and home remedies to help your child find relief. Let's get started. What is eczema? Eczema, atopic dermatitis, is a chronic inflammatory skin condition, redness of the skin, itchiness, and dry patches. It affects up to 20% of children globally, often starting before age 5. Effective management is crucial to improve quality of life and prevent complications like infections, making it a key concern for parents and caregivers. Types of eczema in children. Atopic dermatitis, most common, linked to genetics and allergies, asthma, and hay fever. Causes itchy, scaly patches on cheeks, elbows, or knees. Contact dermatitis, triggered by irritant soaps, wool, or allergens, nickel. Localized redness and itching at contact sites. Seborrheic dermatitis, affects scalp, cradle cap, with flaky, greasy patches. Dyshidrotic eczema, rare in children, small, itchy blisters on hands or feet. Nummular eczema, coin-shaped, scaly patches often appear after skin injury. Anatomy and physiology of skin. In eczema, the skin is the body's largest organ, and eczema disrupts its function. Anatomy of skin. The epidermis, outer layer, contains the stratum corneum, a barrier of dead skin cells and lipids. The dermis houses blood vessels, nerves, and sweat glands. In children, skin is thinner, making it more prone to irritation. Physiology of skin. The stratum corneum retains moisture and blocks irritants. In eczema, a defective filaggrin gene weakens this barrier, allowing moisture loss and allergen entry. Immune dysregulation triggers T-cell-mediated inflammation, releasing cytokines IL-4, IL-13, causing redness and itching. Scratching damages the skin, increasing the risk of Staphylococcus aureus infection. Children's immature immune systems amplify these responses, worsening flares. Causes of eczema in children result from genetic, environmental, and immune factors. Genetic family history of eczema, asthma, or allergies, atopic triad, increases risk. Filaggrin gene mutations, present in 10 to 20% of cases. Environmental. Dry or humid climates, dust, or pollution can trigger flares. Irritants like harsh soaps, synthetic fabrics, or food allergens, dairy, nuts. Immune. Overactive immune response to triggers. Triggers in children: sweat, stress, teething, or infections. Lifestyle factors. Limited access to hypoallergenic products or diets high in processed foods may exacerbate symptoms. Signs and symptoms of eczema. Eczema symptoms vary by age and severity. Infants 0 to 2 years: red, itchy rashes on cheeks, scalp, or trunk. Oozing or crusty patches from scratching. Young children, 2 to 12 years, dry, scaly patches on elbows, knees, or wrists. Intense itching, worse at night, disrupting sleep. Thickened skin. Lichenification from chronic scratching. Complications: bacterial infections, impetigo, or viral infections, eczema herpeticum, sleep loss, and behavioral issues due to discomfort. Impact. Visible rashes may affect children's confidence, especially in social settings like school. Diagnosis of eczema in children is primarily clinical. Clinical assessment of eczema. History, onset, family history, triggers, and allergies. Physical exam. Characteristic rash, red, scaly, or weepy, in typical areas, e.g., flexural surfaces. Criteria include itching plus visible rash, dry skin, or atopic history. Tests. If needed, skin swab. Identifies bacterial or viral infections. Patch testing. For contact dermatitis to pinpoint allergens. Blood tests. IgE levels or eosinophil count for severe cases. Challenges. Misdiagnosis as fungal infections or psoriasis can occur in resource-limited settings. Action. Persistent rashes or signs of infection need a doctor's evaluation. Treatments. Standard treatments aim to reduce inflammation, relieve itching, and prevent flares. Medical treatments. Emollients, moisturizers, e.g., aqueous cream, petroleum-based ointments, applied 2 to 3 times daily to restore the skin barrier. Topical corticosteroids. Mild, hydrocortisone 5%, for face. Moderate, betamethasone, for body. Use short-term, 5 to 7 days, to avoid skin thinning. Topical calcineurin inhibitors. Tacrolimus or pimecrolimus for sensitive areas, e.g., face, in children over 2 years. Antihistamines. Non-sedating, cetirizine, for daytime. Sedating, chlorphenamine. At night to reduce itching. Antibiotics. Oral, flucloxacillin, or topical fusidic acid for infected eczema. Phototherapy UVB for severe cases, though rare in children. Systemic therapy. Oral steroids or immunosuppressants, cyclosporin for refractory cases, under specialist care. Supportive care wet wrap therapy. Apply emollients or corticosteroids, then damp bandages to soothe severe flares. Allergy testing to identify food or environmental triggers. Structured care plans, often involving dermatologists, improve outcomes. Home remedies for eczema. These remedies support eczema management for families globally. Oatmeal baths. Soak in 1 cup colloidal oatmeal for 10 minutes daily to soothe itching. Coconut oil. Apply 1 teaspoon to affected areas twice daily for moisture. Aloe vera. Use pure gel on rashes to reduce inflammation. Chamomile tea compress. Apply a cooled tea-soaked cloth for 10 minutes to calm redness. Cotton clothing. Dress children in loose, 100% cotton to reduce irritation. Humidifier. Use in dry or hot climates to maintain skin hydration. Honey. Apply medical-grade honey sparingly to reduce inflammation and prevent infection. Avoid triggers. Limit dairy, eggs, or processed foods if identified as triggers. Caution. Test remedies on a small area first. Consult a doctor if symptoms worsen or infection occurs. Most affected gender. Eczema affects both genders equally in children. No gender bias. Genetic and environmental factors drive prevalence, not sex. Social impact. Visible rashes may affect children's confidence, with girls potentially facing more appearance-related concerns in social settings. Management focus. Tailored skincare and trigger avoidance are essential for all children, with parental education key. Impact across age groups. Focus on children. Eczema primarily affects children. Infants, 0 to 2 years. High prevalence, 15 to 20% globally. Disrupts sleep and feeding. Young children, 2 to 12 years. Affects school performance and social confidence due to itching and visible rashes. Adolescents 12 to 18. Less common, but persistent cases impact self-esteem. Global data. Eczema's burden is significant worldwide, with higher rates in urban areas due to pollution and stress. Outcome. 60 to 70% of children outgrow eczema by adolescence with proper care, though some may develop related conditions like asthma. Eczema in children can be challenging, but with early diagnosis, treatments like emollients and corticosteroids, and home remedies such as oatmeal baths and coconut oil, relief is achievable. If you found this helpful, like, subscribe, and share for more insights on MedWise by Dr. Naeem. Comment below. What's your eczema tip for kids? Stay healthy.